India mi ka channel banwan ra kubor ba manla kasmi.
Ka Meghalaya Medical Service Association kelapenlong ika jingalang haka RPR terik jemang arajar RPR kelapenlong ika scientific conference kaba RPR ha State Convention Center Shillong haka nega jingalang layadon ringkat usyong kenor ka yingdor bar tawan uba met ba lingdo kum ukongsan menteri ka koi ka Khia uba James ke sangma ki doktor ka koi ka Khia bat kirang ba jong ka Sorkar.
In their careers, but more so, this came into a sharp highlight during the COVID-19 pandemic time. And this really goes to show that despite all those hardships, the challenges, the way that the doctors and other medical professionals, the nurses, our paramedics, frontliners, the way they came forward and the kind of service that they offered at that point of time. It goes to show that being a medical doctor, it is not a profession, it is a calling. And this is a calling which requires a lot of empathy, a lot of compassion, and I'm so happy to see that all those qualities during the COVID-19 pandemic time really came out and we witnessed the kind of service that you offered. Looking at these kind of challenges, we all come to realize that the expectation to remain productive and proactive in this high pressure environment is always very high amongst all the doctors present here and across the state. It is because of this continued sincerity of the medical fraternity that today we, as politicians, as leaders, we also feel very inspired to strive for building a stronger healthcare system in our state. Which brings me to the point that having this association is a really very good thing. This association provides for a community space which provides a support system for each other that is so much required because of the kind of stressful lives that all of you lead. The prosperity and well-being of any country or for that matter any state depends on how robust its healthcare infrastructure is in keeping its population healthy and population productive. Today, as we gather here to acknowledge the scientific contributions of the medical fraternity, it is an honor for me to get the opportunity to express my appreciation and to acknowledge the tireless labor and efforts that you put in to make the system work for our people, our citizens. I think this appreciation is even more heartfelt considering what we saw of our society during the COVID-19 pandemic. Beyond the numbers and the statistics, an important lesson that we